Hey everyone, welcome to Ron's Teachable Talks today. And we have a very interesting topic. Ron, are you interested on what today's topic is?
Well, yes. What are we talking about today?
Okay, we have a good one. So, we talk on and off about, people that experience maybe other pain in their body that might be related to something else. So, question today can is it possible that a heel pain or an Achilles pain is not really a heel or Achilles problem? Can it be something else? And have you seen patients recently where that might have been the case? I know it's pretty niche, but want to see if you can solve our problems today.
Okay, well, definitely. I've had some really interesting experience with patients like that. I'll give you two examples. First one is a 75-year-old woman who came in and had complaints of hip pain that sort of occasionally radiated into her groin
Mhm.
and heel pain. But she said, I've had this for 7 years and I've been to therapy a couple times. And so I think, it's not related. So anyway, we started the treatment and I checked her hip out and everything was normal with her hip. There's no limitations, nothing, and completely normal compared to the other side. But then we started some back exercises and well, the hip started clearing up. And what was even more interesting was the heel and Achilles area started to clear up as well. So we kept pursuing that. And after each visit, she's reporting back, my heel is much better. My Achilles is much better. And I'm not sure what's going on. I don't understand this. And so she has progressed to the point where the last time she came in, she hadn't had any symptoms for half a day, the whole first half of the day in her Achilles or heel. And, she had been through two or three times with PTs, multiple visits for treating that area. And I think next week, well, actually, I think she's going to come in the following week because she got lots of family coming in. I think I'll probably be able to discharge her on a home program because she's got this under control.
Oh,
And so it's been she's just like, I can't believe this. How come I didn't get better before? And then the reason being the back was not looked at carefully enough to determine if it would be possible that the back was contributing or causing those symptoms.
it's amazing how someone can feel such relief. You said she's been in treatment for a chronic issue for 7 years. She's had this for 7 years, and that's a long time to be in pain over something that can be simply solved with having the right person, not just look at, what is hurting you, but going a step deeper and just it's solving the problem at its core and being a little bit more investigative and trying other things. So you solve someone's pain that they've had for 7 years. Don't they wish they could probably dial back the clock and saw you earlier?
Yeah. Um, yeah. And the interesting thing was she said at times it would be very debilitating to the point where she would avoid certain activities because of that. And it limit her walking and, all
Oh
types of,
yeah.
yeah. So yeah, she's did extremely well. And then had another woman, 72 years old, who had a multiple year history of similar heel and Achilles discomfort. And she had told me that they did x-rays and they told her she had spurs on her heel and Achilles. And usually, a lot of times, spurs in those areas are not good, and that can usually be painful. Spurs not always are painful. They can be incidental findings, but so I thought, again, I don't know about this being a back issue, but we went ahead, did the tests, and sure enough, she started responding very well to McKenzie directional preference exercises for the back, not for the foot or anything. And I never did a single exercise for her foot at all. And she has progressed very well, very quickly after not too many visits at all. And she is going to be discharged now on a home program. And I feel like she'll be able to easily maintain her symptom-free status by continuing with the directional preference exercises that she has. And they don't take a lot of time. They can be done anywhere, pretty much. And again, she says, "Well, I'll be happy to give you a 5-star review." And I said, "Okay, sounds good." So I'm going to be talking to her tomorrow a little bit, and we'll go over that, and I'll review her home program with her. So the bottom line is, whenever there's an extremity problem, before you let anybody stick needles in that area or suggest operating, you should have a directional preference evaluation by a McKenzie trained therapist to rule out the spine or rule it in as the cause of the problem. And then you may be able to treat the back and get rid of your problem.
It's amazing, Ron. You've given so many people the gift of mobility and to be able to live pain-free through the McKenzie directional preferences exercises, which is amazing because, what was one thing turned into 3 other things for that patient. But now you've cleared up the one thing and it all melted away. All their pain melted, and now they're getting discharged. So it's a great gift to be able to provide someone pain-free.
Yeah, and it's really encouraging to see that in a patient, to see how their demeanor changes, their attitude changes, like they figure, hey, I got a new lease on life type of thing,
That's
so
awesome. Well,
it's great.
That was a wonderful teachable talk today, Ron. And for those listening that would like their own leash on a new life, definitely contact Ron.